Hello everyone, and welcome back to the channel. Today, we're diving deep into a really important health topic. The treatment of hepatitis B, or HBV. This is a condition that affects millions worldwide, so understanding how it's managed is crucial. We'll break down the treatment for both acute and chronic hepatitis B, explain the goals of therapy, and discuss why regular monitoring is so essential. Whether you or someone you know is navigating this journey, or you're just looking to be better informed, this video is for you. So, let's get started. First, let's talk about acute hepatitis B. This refers to the initial, short-term infection that occurs within the first 6 months after someone is exposed to the virus. Now, here's some good news. For most healthy adults, the body's own immune system is incredibly effective at fighting off the virus. In fact, more than 95% of adults with acute hepatitis B will clear the virus naturally on their own, without any specific medication. Because of this strong immune response, there's usually no need for antiviral treatment in a typical case of acute HBV. Instead, the focus is on what we call supportive care. This is all about helping your body do its job and recover comfortably. It's pretty straightforward. First, get plenty of rest. Your body is working hard to fight an infection, and rest gives it the energy it needs to win that battle. Second, stay well hydrated and maintain good nutrition. Drinking enough water and eating balanced meals support your overall health and liver function. And third, and this is a big one, it's absolutely critical to avoid alcohol. Alcohol is processed by the liver, and when your liver is already inflamed from the hepatitis virus, drinking can put a huge, dangerous strain on it, potentially causing more damage. The same goes for certain medications, or even some herbal supplements that can be toxic to the liver. It's always best to check with your doctor before taking any new drugs or supplements during this time. In very rare and severe cases, where the liver inflammation is extreme, a condition called fulminant hepatitis, hospitalization and antiviral treatment might be necessary. But for the vast majority of people with acute hepatitis B, the prescription is simple: rest, nutrition, hydration, and letting your body heal itself. Now, let's shift our focus to chronic hepatitis B. This is what happens when the virus isn't cleared by the immune system within 6 months. The hepatitis B virus remains in the body long term, and this is where things get more serious. Over many years, or even decades, a persistent chronic infection can lead to severe liver complications. We're talking about things like cirrhosis, which is advanced scarring of the liver failure, and a significantly increased risk of developing liver cancer, also known as hepatocellular carcinoma. This is why managing chronic hepatitis B is so important. It's not about waiting for symptoms to appear. It's about proactively preventing these long-term consequences. But here's a key point. Not everyone with chronic hepatitis B needs to start antiviral medication right away. The decision to treat is a careful one, made by a healthcare provider based on a combination of factors. Your doctor will look at several key indicators. First, your viral load. This is measured with a blood test called the HBV DNA level, which tells us how much of the virus is actively replicating in your blood. A higher viral load often suggests a greater risk of liver damage. Second, they'll assess your liver function. This is done through blood tests that measure liver enzymes like ALT and AST. Elevated levels of these enzymes are a sign of ongoing liver inflammation and damage. And third, they will evaluate the extent of existing liver damage. This can be done through various methods, from simple blood tests and imaging like an ultrasound, to more specialized tests like or in some cases a liver biopsy, which gives a direct look at the liver tissue to check for fibrosis or cirrhosis. Based on this complete picture, your viral load, your liver enzyme levels, the degree of liver damage, and also your age and family history, your doctor will decide if and when it is the right time to begin treatment. It's a personalized approach, tailored to your specific situation to ensure the best possible outcome. So, when the decision is made to start treatment for chronic hepatitis B, what are the options? The primary goal of treatment is to suppress the virus. We want to stop it from making copies of itself. By controlling the virus, we can reduce liver inflammation, prevent further liver damage from occurring, and dramatically lower the risk of developing cirrhosis and liver cancer. It's important to understand that current treatments control the virus very effectively, but they don't typically eliminate it from the body entirely. Think of it like managing other chronic conditions like high blood pressure or diabetes. The medication keeps the problem under control to prevent complications. For this reason, treatment for chronic hepatitis B is often lifelong. The mainstays of treatment are oral antiviral medications. These are pills you take once a day, and they are highly effective and generally very well tolerated with few side effects for most people. The most commonly prescribed first-line drugs today are tenofovir disoproxil fumarate, often called TDF, tenofovir alafenamide, known as TAF, and entecavir, or ETV. These medications work by interfering with the virus's ability to replicate, effectively pushing the HBV DNA levels down, often to undetectable levels in the blood. TAF is a newer formulation of tenofovir that has a similar effectiveness to TDF, but with an even better safety profile, particularly regarding kidney health and bone density over the long term. There's another class of medication called pegylated interferon alpha. Unlike the daily pills, this is given as a weekly injection for a fixed duration, usually about 48 weeks. Interferon works differently. It boosts your own immune system to help it fight the virus more effectively. It's used in certain, carefully selected patients, often younger individuals with active liver inflammation but without advanced liver disease. While it offers the chance for a finite course of treatment and a higher rate of a specific type of cure called HB-Sag seroclearance, it can also have more significant side effects, like flu-like symptoms, fatigue, and mood changes. The choice between daily oral antivirals and interferon is a complex one, made in discussion with your specialist to determine the best fit for your specific health profile and lifestyle. Once you start treatment for chronic hepatitis B, or even if you're in a monitoring phase without medication, regular checkups are absolutely non-negotiable. This is how you and your doctor stay on top of the condition and ensure your liver remains healthy. This ongoing surveillance is the cornerstone of good long-term management. So, what does this monitoring involve? Primarily, it involves regular blood tests, typically every 3 to 6 months, although the frequency can vary. These tests will track several key things. First, your HBV DNA, or viral load, to make sure the medication is effectively suppressing the virus. The goal is to get it to an undetectable level. Second, your liver function tests, like ULT, to see if the liver inflammation is resolving. Third, they will test for specific hepatitis B antigens and antibodies, like HBAG and HBsAg, which provide more information about the phase of your infection and your response to therapy. Beyond blood tests, monitoring also includes periodic screening for liver cancer. Remember, even with a well-controlled virus, the risk of liver cancer, while greatly reduced, is not zero, especially if you already had some liver scarring or cirrhosis when you started treatment. The standard way to screen for liver cancer is with a liver ultrasound, usually performed every 6 months. This imaging test allows your doctor to look for any suspicious spots or tumors on your liver when they are small and most treatable. In some cases, a blood test for a tumor marker called RFP, or alpha-fetoprotein, is also done alongside the ultrasound. This combination of regular blood work and liver imaging is your safety net. It ensures your treatment is working, catches any potential issues early, and gives you the very best chance of living a long, healthy life, free from the severe complications of hepatitis B. So please, never skip these appointments. They are just as important as taking your medication every day. To wrap everything up, let's quickly recap the key takeaways. For acute hepatitis B, the body usually clears the virus on its own, and supportive care, like rest and avoiding alcohol, is the main approach. For chronic hepatitis B, the goal is long-term viral suppression to prevent serious liver disease like cirrhosis and cancer. This is achieved with highly effective oral antiviral medications like tenofovir or entecavir, which are often taken for life. The decision to start treatment depends on your viral load, liver function, and the degree of liver damage. And finally, whether you are on treatment or not, regular monitoring with blood tests and liver ultrasounds is absolutely essential to protect your health long-term. Managing a chronic condition can feel overwhelming, but with the right medical care and consistent follow-up, people with hepatitis B can live full and healthy lives. Knowledge is power, and understanding your treatment is a huge step in taking control of your health. Thank you so much for watching today. I hope this information was clear and helpful. If you found value in this video, please give it a thumbs up and consider subscribing to the channel for more health content. And if you have any questions, feel free to drop them in the comments below. But always remember to discuss your personal health situation with your own healthcare provider. Stay safe, stay informed, and we'll see you in the next video.